So good morning and welcome everyone to our joint webinar this Saturday morning. And this is our second webinar where we talk about common medical conditions, sharing with you self-help tips and Western and Chinese medical treatment and approaches to common conditions. So today, Lily and I are going to be talking about the topic of primary dysmenorrhea. So we'd just first like to introduce ourselves. So my name is Dr. Clare Tong. I'm a GP and I've been working in the NHS for over 13 years. And currently I also work in the private sector as a health assessment doctor, also providing some online consultations.
And I am Lily Lai. I'm a traditional Chinese medicine practitioner, so I offer both acupuncture and Chinese herbal medicine. I'm now working in Manchester, previously having sort of worked more in Hertfordshire down south. I'm also a clinical researcher, so I've been in clinical practice for almost 20 years now, but I did a PhD in Southampton on the topic of a women's health condition called polycystic ovary syndrome. So I've got real interest in the research side of stuff as well as the integrative medicine side of stuff. So yeah, personally really delighted that myself and Claire, we can both talk to everyone in this more integrative way, because I find personally it's a better option when we can look at all the useful options in front of people for various conditions. So no, hopefully you guys will enjoy the talk today and find it useful.
So I'll just run through today's agenda. So we're going to be talking about what is dysmenorrhea, why is it important, this topic. I'm going to talk about primary and secondary dysmenorrhea and some of the typical symptoms of this condition. And then we're going to focus a little bit more on primary dysmenorrhea, the cause of it, how do we diagnose it, and then the treatment in the Western medicine perspective, some self-care tips and some lifestyle advice. And then Lily will come in and tell us all about the Chinese medicine perspective for managing this condition. So now, what is dysmenorrhea? So we love big words in medicine, don't we? So if we just break it down, dys means abnormal or painful, meno means menstruation, and rhea means flow. So dysmenorrhea basically means painful periods. Now, there's two main types of painful periods, dysmenorrhea. There's primary dysmenorrhea, and this means period pains without any underlying medical condition, so no pelvic pathology. It is the most common gynecological women's health conditions worldwide. And secondary dysmenorrhea is where we have period pains with an underlying pathology. So for example, conditions such as endometriosis and fibroids. So why is it so important to talk about this topic, and why have we chosen this topic? Now, some of you who are here today may suffer from painful periods or probably know someone who does. I certainly have a friend I know that we can counter out for out gatherings and social occasions when she's on her periods. So it is a very common condition. 16 to 91% of women in reproductive age will have dysmenorrhea. And the prevalence rate you can see here varies so widely, probably because of different definitions of dysmenorrhea, different methods of data collection, and such a diverse study population. But this is a very common condition. It can really affect your quality of life and your well-being. Imagine having a pain that comes back, every single month. It can affect your daily activities. It is the most common reason for being off school and from the workplace, and also not being able to attend social activities. Now, most people actually don't seek medical advice for this and try to manage it themselves. And one of the reasons is because it can be normalized. So sometimes people think, well, it's normal for periods to be painful, isn't it? Or some people, it may be dismissed, or some people may sort of make you feel like the symptoms are exaggerated. And why has it impacted you so much for you to be stay in bed for this. It's normal for it to be painful. However, it is not normal when the pain is starting to affect your daily life, starting to limit what you normally do. So, primary dysmenorrhea. So if you remember, this is painful periods where there's no underlying medical condition, where we discussed before. So it is more common in adolescent and younger adult females. Typically, it starts 6 to 12 months after the start of your periods, once your cycles are more settled, once they're more regular. And there are some associated factors for this condition. So if you started your periods early, or if you've never been pregnant before, if your periods tend to be quite heavy, and also if there is a family history of primary dysmenorrhea. Also, stress, smoking, lack of exercise, and obesity can also be associated with this condition. Now, some of the typical symptoms, so just to describe this, so it's a cramping type of pain, so like a spasm pain in your lower abdomen typically, and it can certainly spread to your lower back and also to the inner thighs. And usually it will start at the beginning of your periods or just before it, and can last up to 3 days from when it starts. And it is quite common to have other symptoms associated with this. So not just the pain. So you can feel sick, you actually be sick. You can have headaches, dizziness, even fainting. You can feel very tired with it and even associated with diarrhea. So it can be really debilitating. And how do we diagnose primary dysmenorrhea? So you come to me as a GP, what really important is we take a really good history. We will ask you, when did it start? What's the describing the pain? We want to know everything about your menstrual cycle. Do you have any other symptoms? Any gynecological symptoms? Sort of some risk factors? Obstetric history? Have you been pregnant before? The different medication you've tried? We'll have a feel of your tummy. We'll do a pelvic examination and a speculum examination to have a look inside if it's appropriate. And also, we will consider doing other investigations, such as a pelvic ultrasound. We might do some swabs, pregnancy test. So all of this, essentially wanting to differentiate between primary and also secondary dysmenorrhea, whether there is an underlying cause that is causing the painful periods. So now I just want to have a slide really to talk about secondary dysmenorrhea. So secondary dysmenorrhea, as remember, is where there is an underlying pelvic pathology causing the pain. So this is different to the primary dysmenorrhea, from where it often occurs several years after the onset of periods. The pain is not just related to your periods. So it can be start before, quite a few weeks before your periods, and not just in the first sort of couple of days of your periods. And it's certainly, it can be worse during the time of your period. And there's usually other types of gynecological symptoms. So for example, you may have irregular bleeding, you have heavy bleeding, bleeding with intercourse, and vaginal discharge, dyspareunia, then this means painful intercourse. So this gives us as an indication whether there is an underlying cause. Or we do think about this as well, if someone's tried treatment for primary dysmenorrhea and it's not been effective after 3 to 6 months, we will think about thinking about other causes. So in this box below, you can see some of the causes of secondary dysmenorrhea, such as endometriosis, adenomyosis, chronic pelvic inflammatory disease, fibroids, intrauterine polyps, so coils, so intrauterine contraceptive device, so in particular the copper coil. And then there's less commonly any genetic, congenital, not genetic, congenital uterine abnormalities, cervical stenosis or narrowing, or any problems with the ovaries. So now, secondary dysmenorrhea, there is an underlying cause, but what is the cause of primary dysmenorrhea if there's no underlying sort of structural pelvic pathology? So here we talk about prostaglandins. They are the culprit of causing this pain. So prostaglandins, they are chemicals that's released by the uterus at the start of our menstrual cycle. And these chemicals causes uterine muscle contractions. And you can imagine when the muscles contracting, it can sort of squeezes all the blood flow that's within the muscles. And as it does that, less oxygen gets to the muscles, and that causes us pain. So it is thought that people who have primary dysmenorrhea have higher levels of prostaglandins compared to people who don't suffer with this. So, right, I'm just going to move on to how we manage it. And so first I'm going to talk a bit about sort of more non-pharmacological treatment, so some lifestyle advice. So a lot of people will find sort of different positioning can help. So for example, just lying on your front or curling up will help with the pain. Certainly heat, so local application of heat, so using so hot water bottles, heat patches, and then exercise. So it may seem a bit mad to tell you to exercise when you're in that much pain, but actually we know that just simple stretches, some Pilates or yoga can help with the pain. And then also, so using a TENS machine. And Lily's going to talk to us a little bit more about that. And also we'll have some really interesting self-help tips from Lily later on. So other things like acupuncture, massage, aromatherapy, some deep breathing exercises, even hypnotherapy that can sometimes help with the pain. And then, so now I just want to introduce you to Emma to help us sort of run through what we would do as if you come to me as a GP in terms of medical treatment for primary dysmenorrhea. So Emma comes in with her mom, and Emma is 16 years old. So she started her periods about a year ago, and gradually they are getting more painful, in particular the first few days of her period. She's not currently sexually active. It has caused her to miss some school days, her favorite gymnastic classes. She's had to cancel on her friends, and her boyfriend just feeling a bit helpless. He doesn't know what to do every month when she's, how he can help her when she's on her period. They've tried paracetamol, not really working. And mom had painful periods too when she was a teenager. So we took a good history and feel of her tummy, and so I then diagnosed her with primary dysmenorrhea, as she has no other sort of symptoms that suggest otherwise. So now, what I will do is talk to them about their options. So what I normally do is I'll talk about some non-hormonal options and hormonal options. So we're going to talk about non-hormonal options first. So if you remember, the cause of the pain in primary dysmenorrhea is those prostaglandins, isn't it? So the first line treatment would be a non-steroidal anti-inflammatory medications such as ibuprofen, because they work on inhibiting the enzymes that the body uses to make these prostaglandins. So we would, so ibuprofen. And there's another good anti-inflammatory called mefenamic acid, which is available on prescription. So this is also effective because it also has some properties where it helps reduce cramping as well. So the tips for taking these anti-inflammatories is that you want to start this at a higher dose, sort of maybe 1 or 2 days at the start of the period. And the important thing is to take it regularly. So don't just take it as the if you think the pain is bad, you would take 1 or 2, but make sure you take it regularly, for example, 3 times a day, even though the pain is not that bad. So that will help you get through the period pains. And you can take this with paracetamols, you can use your hot water bottle with it, you can use your TENS machine with it. And I would suggest always just to check with the pharmacist or your doctor if you're taking the anti-inflammatories, just make sure there's no contraindications, no drug interactions, looking at medical history, see if there's any monitoring requirements, because it may not suit everybody. So Emma has decided that she wants to choose to try some mefenamic acid this time, on this occasion, for her painful periods. And she's going to come back and let me know how she gets on. So Emma comes back 3 months later. She tells me, with her mum, she comes back with her mum. She tells me, yeah, mefenamic acid is working okay. But now they have talked together and she's now thinking about contraception as well. So moving on to that, so I want to talk about the hormonal options then of managing primary dysmenorrhea. So this is also a very effective management of this, and how it works, it inhibits ovulation, and in turn, it reduces the prostaglandin production, helps reducing menstrual flow and the pain. So for Emma at this stage, as she is starting to think about contraception, we thought, okay, so okay, well, we talk about all the benefits and risks, and she said, yes, I would like to try this. So the common ones that in terms of hormonal options that we would prescribe is one, the combined oral contraceptive pill. Secondly, there is a progesterone-only contraceptive pill. So normally if one has any contraindications, then we would we'll talk to them what is the best option for them. But normally for reducing the pain and make periods more regular, combined oral contraceptive pill is a better option. There are also other options. So the Mirena coil. So the Mirena coil, and you may know about this. So Mirena coil is a small intrauterine device that it's about, so maybe this, yeah, very small, this big. It gets inserted into the womb, and it releases progesterone locally. It just helps thin the lining of the womb, and also can inhibit ovulation as well. So this can be certainly used as a form of contraception and also help with her painful periods. I've just introduced these other options like the Nexplanon. Nexplanon is the contraceptive implant. Depo-Provera is the contraceptive injection. Again, this also works by, it's progesterone basically, can inhibit ovulation. Cyanopress is a subcut hormonal contraception, which works similar to the hormonal injection, but is a subcut version. So at this stage, after discussing with Mom and Emma, Emma chooses to try the combined oral contraceptive pill. We discuss how she takes this, and we then arrange a review with her in 3 months' time. So, and then we can see how she gets on with this. We can review her, whether it's working or not. And if it's not very effective, we may think about other sort of investigations. All right, so this concludes my part of the talk, and Lily's going to now talk to us about the Chinese medicine approach to this condition.
Thank you so much, Claire. So I'm here to talk to you about the Chinese medicine side of things. So I guess for me, patient care pathway to Chinese medicine in the UK. So typically, because Chinese medicine is considered a complementary and an alternative form of medicine, most people will think about using Chinese medicine once they have tried usually a variety of different things after they've seen their GP. So most of the patients that I would say in my practice are usually falling into 3 broad camps. So mostly they are either unable to carry on with medications, sometimes because they are experiencing side effects, and so they are needing an outright alternative. There's no other kind of options that they feel like the conventional side of things are able to offer them anymore. And then these final two, which is probably more common. So they are concerned about increasing dependency on analgesics, or their increasing dosage of it as time has gone on. And or they are potentially getting some degree of relief with conventional treatment, but not quite enough. And they're wishing to integrate what they're currently taking with other drug-free sort of alternatives for pain relief. So this is really where that kind of more integrative side of things, for me, the way that I like to work is really, I find, is sort of really kind of resonating with most of the patients now that I see in practice. They're not necessarily looking for an alternative all the time, but they understand that actually there is a time and a place for all these different options, and it's how comfortably it sits with them at that particular time. So in terms of the Chinese medicine approach, typically when we see patients in practice, we'll look at them with a Chinese medicine lens. We will think about sort of what's going on in a conventional way, in a scientific way. But when we're looking at people with a Chinese medicine hat on, people with period pain will typically be seen as having a circulation issue. And this can be either a form of energy called qi in Chinese medicine, but also we will typically see a lot of people who have a lack of warm energy in the body, known as yang. And some of you will have heard of yin and yang. They have slightly different sort of kind of actions on the body, but with period pain, typically we see there as being a lack of this yang warm energy. When it comes to the energy that I mentioned being stuck, qi, this can essentially create spasms, contractions in that local area in the pelvis. So essentially we would be using treatments that typically involve releasing and moving that qi, as well as treatments that help with the yang side of stuff, the warming energy side of stuff. So things to boost the yang. When it comes to broadly those two kind of types of energy and looking at both of them, in reality, in Chinese medicine, we will often see lots of different things that are happening in the body, but broadly period pain will usually involve one or sometimes both of these. And the way that we look at and sort of differentiate between the two different types essentially is by looking into the medical history and asking a bit more about the nature of the pain, or how different other symptoms they have. So for example, with a girl, a woman who might sort of have more qi circulation problems, their period pain tends to be worse with stress, tends to be better with movement, as Claire has mentioned, with the gentle stretching, the yoga, but also with potentially using TENS machine as well. And these are because stress tends to block your energy up in Chinese medicine terms, and gentle movement and TENS will tend to gently move your energy. So this is why it's particularly suitable for this kind of person. When it comes to their bleeding, and Chinese medicine practitioners will tend to ask a lot about things like menstrual bleeding, sort of the type of blood that you have and clotting and things like that. So typically this kind of patient will have a dark clotty bleed during their period, but also they'll tend to have more premenstrual symptoms. So symptoms like tiredness, maybe headaches, maybe bowel changes on the run up to their period. And they usually will have a bit more sort of propensity for having things like breast tenderness as well. When it comes to the right side, so the low yang energy kind of people, what we tend to see is that the period pain gets better with heat, and they tend to prefer this kind of curled up fetal position, sometimes holding something on their belly like this lady is doing, holding a cushion, but sometimes this is just, you know, with a hot water bottle. It's that pressure that can help with this kind of patient. What they can also do is they can present with spotting before their period. So sometimes this is like a brownish spotting, maybe a few days beforehand. And they can have a tendency to looser bowel movements as well. But also because of that low warm energy in the body, they'll tend to have poor circulation. So feel particularly cold, usually hands and feet, and will tend to be more on the lethargic side as well. So this is very kind of broad brush, but it's kind of an intro to how we look at and kind of diagnose people with different patterns of symptoms. When it comes to looking broadly at what the science says, so we now have sort of quite a big sort of range of different studies, both from animal as well as human studies that have shown acupuncture as well as herbal medicine can help with painful periods in a number of different ways. So remember that cascade, that diagram that Claire gave us about essentially the pathophysiology behind why we have primary dysmenorrhea. So essentially, the evidence points to helping in various ways. So from increasing the blood flow, which, as we know, helps to reduce uterine spasms, but also dilutes those pain-inducing prostaglandins in that local area, and helping with improving oxygen levels in that pelvic area as well. We also know that particularly acupuncture can help to block pain signals from the womb to the brain. So that's one of the ways that acupuncture works. It's not the only way, but that is also why self-help things like TENS can also be effective for patients as well. The other sort of lesser known sort of aspects of how acupuncture and herbs can help is by regulating the activity between the nervous system and our hormone system as well. So this is the idea of this is to sort of allow our bodies to cope better with pain by helping our body sort of create more of these neurotransmitters, so endorphins and serotonin, which helps to lessen our kind of that intensity of the pain. But also it can also help with reducing levels of inflammation in the body, which can contribute to it as well. So this is probably also one of the reasons, probably in the inflammation side of stuff, this is probably how Chinese medicine can work well for those secondary dysmenorrhea types, so endometriosis and actually PCOS as well, which is a big, it's inflammation involving those particular conditions, which can bring on those painful periods. So, but for primary dysmenorrhea, inflammation can also be involved too. In Chinese medicine, though, we do look at obviously the experience of pain that those women are getting month on month, but we also do try to take a step back and look a bit more broadly in terms of what factors in a patient's health or maybe their lifestyle at the time might be contributing towards that monthly pain that they're getting. So we do sort of question more broadly as to what's going on, and it allows us to work on treatment that tries to prevent period pain in the first place, or, you know, at the very least minimize its intensity, so that we're kind of treating it before it happens, and hopefully when your period does come, then there's less of that kind of congestion, there's less of that sort of propensity for that high prostaglandin level to be created in the first place. And hopefully by that, we'll be looking at sort of impacting and improving on that person's quality of life as well. So what can we do in Chinese medicine? So I'm going to go through a few of the different common things that I would use in clinical practice. So acupuncture, you know, probably the most well-known of Chinese medicine treatments. It's very well documented for its effects on pain anyway. Tends to be the go-to Chinese medicine treatment here in the UK. We tend to use acupuncture points in different parts of the body for helping in different ways. So probably very obviously, pelvic area and lower back tends to be some of the areas that are most commonly affected. And this helps locally with improving circulation, reducing those high prostaglandin levels, reducing spasms, and also balancing out hormones too. The other two areas that we tend to work on, hands and the feet, these help with the whole body circulation, or specifically if there are those kind of various symptoms that Claire's already mentioned, like nausea, vomiting, or migraine. There are particular areas and particular points in these areas which can help with those kind of associated symptoms. Ear acupuncture has become sort of really more well known in the last year or so. Ear seeds we can leave ear seeds as well for patients so that they can go home with this kind of additional sort of benefit from the ongoing sort of physical treatment when we see patients. But essentially we understand it to be helping in part with regulating the vagal nerve. But in Chinese medicine terms, we'll also be looking at specifically helping with calming stress, reducing anxiety, and helping with pelvic blood flow in certain acupuncture points in the ear as well. So this can be a really, really useful tool. Moxibustion is a lesser well-known sort of Chinese medicine treatment, and it's essentially one of the warming treatments that we offer in Chinese medicine, and it involves burning a Chinese herb called Chinese mugwort. There's a picture there on the side of me holding what we call a moxa stick, and you can see there that I'm holding it above the skin. So when we light up this moxa stick, or there are different other ways of doing moxa as well, this is one example. But we essentially apply the heat at certain acupuncture points. And with a moxa stick, we're hovering it above certain acupuncture points. Because of the intensity of the heat and the properties of Chinese mugwort, it is really useful as an analgesic and relaxing uterine contraction. So if a person has got period pain at the time of the appointment, that can be a really, really soothing way of introducing quite a deep sort of sensation of heat in that area. Helps to stimulate circulation, regulate hormones, but it really, really is quite relaxing and very soothing as well. So because of it involving no needles, this can be really popular amongst some of my adolescent patients or people who are a bit sort of needle phobic, essentially. So this can be really, really popular amongst these kinds of patients. But I do also use it alongside acupuncture quite commonly. So when a patient has got the needles in, they're resting on the treatment couch, then I'll be doing essentially the moxibustion alongside the acupuncture during that 20-30 minutes when they're relaxing.
So Lily, so we do have a quick question here.
Yeah.
So there's a question from Polly. So just asking, would you use a heat lamp if not using moxa?
Yeah, absolutely. So heat lamp is something that I commonly use a lot, an infrared heat lamp. I don't know if she's an acupuncturist herself. So but essentially that's something I do quite commonly use. I think for me, in terms of preferences for it, so heat lamps can still be really intense, I find, though, so the heat can be really still very soothing, very effective. I probably find I prefer to do moxa because it is that little bit more intense, and also there's that additional kind of herbal therapeutic property of the mugwort. But also I'd probably say that in the past it's actually more practical in terms of limitations. So if I'm sharing, for example, a treatment room, so I use a treatment room alongside other practitioners, for me it's about that consideration of smell for other practitioners when they use a room after me, rather than to do with rather than to do with a patient per se. So so using the heat lamp, yes, can so I'm just admitting somebody in. Using a heat lamp can still be really effective. And I find when I was limited in terms of not being able to use moxa for a little while, I would still say it's still reasonably effective. So I would just say, if you are thinking about investing in one or another one, I do find that the double head lamps are particularly useful for anyone who is looking into it. So you can have single head, double heads. I really, really would say the double heads for me work as long as you got the treatment space for it. So that's a very long-winded response, really. So hopefully it's useful. Any other questions?
No.
No? Okay, sure. Great. So now turning to Chinese herbal medicine. So in the UK, registered practitioners, we don't use any animal products, no minerals, so very sort of vegan-friendly, plant-based herbs only. Typically, we put together a prescription, essentially. So it's a mixture of different herbs which are tailored to each individual, which is why also we tend to really question a person's medical history, because we obviously need to check for interactions with whatever meds they are already taking. So we need to be careful about sort of interactions with those conventional medications. But also because we need to figure out which herbs to use for a particular patient. So a particular prescription can contain anything from between 5 herbs to sometimes 15 different herbs in a particular prescription. And the reason for that is because often we'll group them into helping with a particular person's presentation. So in this case, it's period pain, but a typical prescription will have some herbs which help with pain relief, some herbs which may particularly have good evidence for reducing prostaglandins, some which have anti-inflammatory effects, and some which are pro-circulation. So it's getting that balance between what's more important and more likely to be more effective for that patient in front of us. So I can write 5 different herbal prescriptions for primary dysmenorrhea, and they can all look slightly different. So and that's the beauty of seeing a practitioner for these more tailored sort of herbs, essentially. When it comes to self-care, so I have taken this from NICE's clinical knowledge summary, and essentially there are various ways that even from NICE they do recognise can be helpful. So local application of heat, which Claire's already mentioned, that can be hot water bottle or wheat bag or heat patch. Some of my patients actually do have heat lamps at home, I think probably from other members of the family who might already be using it for various things like fibromyalgia. So if they already have access to something at home, I will ask them to use that regularly, not just at the time of the month when they're getting pain, actually. So the other thing that is recommended by NICE is the use of TENS, and specifically they said set to a high frequency. So high frequency, when you look at the literature, it's anything above 50 hertz, but up to 100 is used in a lot of the clinical trials, which they have tested various TENS machines with, specifically for primary dysmenorrhea. A low frequency, just for reference, is something like between 2 to 5 hertz. So for me, the most important thing when talking to patients about using TENS is about making sure that there's a machine that allows you to set that frequency, essentially, because there's no point having something that's preset at a low frequency because it's not, the evidence isn't there to support it being useful for dysmenorrhea. With TENS, my UV, as some of you who either have period pain or know somebody with period pain has probably heard of this. This is probably one of the best marketed painful period products out there. Really, really good marketing. And for me, it's about sort of getting, building awareness of actually other alternatives that can be helpful for people. So this is great because it is completely wireless, portable, it's chargeable. And it has some frequency settings you can adjust. And the idea is that with any TENS machine, not just this one, but any TENS machine, is that you gradually increase it to your highest tolerable level. So, and then keep it at that level. With this particular product, I'd say, so essentially what's happening is that there are sort of 2 electrode sort of pads, essentially, which is there's a small electrical current that's being passed between those 2 different pads. And that's on what they call their butterfly strip, essentially. So as you can see, it's reasonably sort of, it's a kind of probably a typical sort of area that you would expect for somebody to get period pain. And you can use this, you can stick it on anywhere in that sort of pelvic area as well as your lower back if you're getting period pain. But I'd say because it is limited to this particular shape and this particular distance, it does limit probably the area that you can treat at the time, essentially. So I would say that it's suitable for a lot of people, but other TENS machines might be a better choice. And some of it is due to it covering a wider area with adjustable distance between electrodes. So this, the only downside of this is that it tends to be wired, and so you can feel a bit limited in terms of having to carry a machine around with you, a small machine, albeit. If you can get something that is able to modify the frequency, so as I've mentioned, high is anything above 50 hertz. If you can build it up towards 100, this tends to be the most effective. But like I said, comparison low is 2 to 5. With the MyUV, you can adjust it, but the settings are set to, I think it's 1 to 6. So you can adjust it, but you don't really know what 5 is, you don't know what 6 is. And so for me, it feels like if you're kind of a little bit more like me, sort of into the numbers, then something where you can dial it up to be able to just register how intense you're able to tolerate it for this time round. That feels a little bit more useful, essentially. Also the replacement electrode. So MyUV, you can reuse this strip quite a number of times. I can't remember what they've said in their literature now, but it, it's expensive to replace them. and you're getting monthly cycles, so you will need to replace them. But some of the other options and brands can have cheaper replacement electrodes, essentially. So just do your research and look a bit more. But this is a product, if people are coming to me and say they're using it and what I think of it, I do think it can be a really good product, but that there may be better options out there. Okay, and then moving on to something a bit more Chinese medicine specific. So one of the most common things, if you had to step away from this talk and only remember one thing, so apart from my talk, so not from Claire's as well, but from my talk, it will be about the temperature of food. This is probably something I counsel patients on all the time with regards to trying to, especially at this time of year, focus on eating more warm and cooked food and warm drinks. So even if it's the height of summer, if you're somebody with period pain, that especially if it responds well with heat, I would say this is probably one of the things that can really help with improving your energy, your yang energy specifically, and help to move your energy, your qi energy. So this means with warm and cooked food, trying to replace things like cereal for an omelette, or maybe rice congee if you're familiar with those more Asian style sort of breakfasts, or porridge, obviously. And then for lunch, instead of a sandwich or a salad, swapping it for a soup or maybe a broth instead. And then dinners are probably the areas that I have to advise people on the least, because that's most commonly most people's sort of main cooked meal of the day. So usually it's trying to see if we can think of options for breakfast or lunch that's doable, that's still kind of quick, or they can have on the go. And then things for desserts, it's like having a warm fruit stew or a warm chocolate cake rather than ice cream or sorbet. Avoiding purely cold raw meals like just a salad or just a sandwich. If you do really like your salads or your sandwiches, trying to have something warm with it, like a grilled chicken, or having like a hot bowl of soup, a small bowl of soup with it, or even a hot drink that can help lessen the impact of that sort of cold on our digestive system. And then having things like hot tea, warm water. This is something that's really commonly done in Asia. So just because of that awareness of cold affecting our system. So if you can tolerate warm water, great. But if you can't, then having even just room temperature water is definitely better than having icy water or water that's straight from the fridge. And then the other piece of advice that I often will give is talking about incorporating more what we would consider Chinese medicine warming herbs into your diet. So cinnamon, ginger, probably the most sort of readily available, but also widely prescribed amongst Chinese herbalists like myself for period pain. So, and when you look at prescription analyses that are done in Taiwan and China for things like period pain, these are kind of easily 2 of the top 10 basically. So it makes sense to incorporate some of this into our into our diet. It's best used preventatively and reasonably regularly. I wouldn't say you need to do it every single day, but it means you can start at any time of your cycle. And essentially, this is a really simple recipe for using ground cinnamon and then grated ginger, steep in hot water. You can moderate it with some lemon if you like, or a bit of honey. But essentially, you've already got the 2 sort of key components of a typical Chinese herbal prescription used for period pain. Other warming herbs you can consider using: star anise, clove, nutmeg, and garlic. These are really common sort of ingredients in broths like Vietnamese pho, but also in Chinese 5-spice. And also, now that we're going into the winter months in the UK, mulled wine. But yeah, essentially sort of a lovely kind of warming action on the body. We can sometimes also advise patients to use these herbs in a foot soak. You don't have to use the herbs. You can just do a warm foot soak. So essentially all that involves is putting sort of using a plastic tub, popping your feet to make sure that the water level is just above your ankle. And what that does is it's firstly really relaxing, but also there are various acupuncture points around the feet, around the ankle, which we use in Chinese medicine also, which we obviously as practitioners we needle. But if you can stimulate it with heat, then that is also something else that can be super useful too. So you can use it with these warming herbs, but again, you don't have to. You can just do a plain foot soak, and that can be something that works really well, especially alongside Chinese medicine treatments. So side effects is something I do get asked a lot about, obviously, things like acupuncture and herbs as well. So in the hands of experienced traditional practitioners, serious side effects are super, super rare. So there are, however, some training courses which do only last a few weekends, which compared to traditional acupuncture and Chinese herb medicine, where we will often be doing 3 or more years of training. So please, please, please do check when you do choose somebody to see that their training is ideally
fantastic.
Sorry, I don't know who's talking. So is that Louise? But yeah, so it's just to sort of say, if you can just double check, that'll be really, really good. It means that you're in really good hands with somebody who has had that more traditional training. Serious side effects for acupuncture, really rare, so fewer than 1 in 10,000, which makes it a really safe method of treatment. Some of the more common side effects may be things like minor bleeding or bruising in 1 to 10%. So again, something that's usually really tolerable in most of my patients, and so yeah, something that people are really sort of happy to accept. Individualized herbs rarely have side effects. If you're going to have any, typically, I would say they're gastrointestinal in my experience. So there may be some bloating, maybe changes to bowel movements. And I would say typically they happen in the first 48 hours as your body is getting used to taking herbs. But after that, we don't usually expect the side effects to continue. If they do, then usually your practitioner will be able to modify the prescription just to minimize that. But again, really, really unusual, very rare. When it comes to receiving treatment, finding a practitioner, so some NHS pain clinics will offer acupuncture for pain of other kinds, but in my experience is rarely for dysmenorrhea. Is that the same for you, Claire? In terms
I would say
local
so.
clinics? Yeah. So I'd say just check your local provision, check with your GP. But it's worth checking, but yeah, it may be that you're having to go through either private health insurance provider or paying for it out of pocket. So private health insurance providers, again, can cover part or all of the costs. Check the terms of your individual policy. And ideally, choose somebody who's been recommended by a family or a friend. A lot of practitioners, we will say in our literature, so website, leaflets, whatever, that we're registered with particular professional bodies, which is really good. What I would say is, if you can, just back check it. So go onto the professional body's website that they say they're registered with, and just make sure that their registration is still active, because you can just sort of fall out of that registration even if you've been registered a few years ago. So it's just to double check that, especially if you're claiming back on your health insurance, because they'll need to provide receipts and things like that. So something that most of us traditional practitioners will do is offer a free 15-minute consult prior to booking. So do make the most of that. So arrange that chat. Usually it's by telephone, where you can ask them about their experience of treating dysmenorrhea, and just get a gauge of kind of how they work and how they are, and just see if you feel like you're gelling in that initial chat, essentially. So yeah, so make the most of that. And that's me done. So thank you very much, everyone.